Hey everyone, and welcome back to another video. It's been a bit of an intense 48 hours. I had to, I woke up the other morning and I just finished having a coffee, and then my son rang and said that Grandpa wasn't feeling very well and Nana's called the ambulance, and so I had to hightail it up to my parents to see what was happening. My dad was having one of his heart episodes. He does have a history of AF, which is atrial fibrillation, which is when the heartbeat basically goes all over the place. And if it's not brought under control, it can cause a heart attack or a stroke. So it's quite serious. You can die from it. My dad's had a history of that for the past 10 years, and I've had to call the ambulance many times. I've had to take him to the hospital many times. The first couple of times it happened, I took him to the hospital because we didn't know what was going on, and then now we just call an ambulance because it can be quite bad. Like one time he had an episode and he couldn't even speak. It was so bad. He just started bawling and couldn't even get his words out, and that was pretty intense. We were all having a celebration, I think, for my mum's birthday or something. I can't remember. We were having a celebration for something and everyone was there, and then that happened. So everyone was like, oh, geez, this is intense. But luckily it was only a minor episode. I've seen him far worse. So I wasn't too worried, but it still obviously needed to be addressed. So yeah, we just waited for the ambulance to come, and they did all the things that they do. They did an ECG right there in the lounge room, and he went to hospital, and then I had to stay there for a couple of nights to look after. Just my mum's pretty good now, so not to look after her. I mean, when she first started getting out of hospital and having all of her attacks with her COPD, she would need help to get on the BiPAP machine and all that sort of stuff. But now she's pretty good. She can put herself on it. She's going okay. But I'm just there just in case. Like, it would be awful if she had a fall or something during the night, things like that. Or if she needed help with something, or, make her a coffee in the morning because she can't grip the kettle, things like that. So I stayed there for 2 days and it was just a bit full on. Yesterday I ran around paying my dad's electricity bill, did some shopping, just did all the things that needed to be done yesterday. So I'm home now and I'm still a bit on edge. Like, I am a little bit stressed just because I'm worried that my dad may have another attack, because normally when he has a small attack, it's normally a precursor to a bigger attack. And when he's had the big attacks, he's had to have his heart restarted to put it back into a normal rhythm the last couple of times. So, it's a bit scary. And basically, when he got to hospital, his heart went back into normal rhythm, which was really out of character and really strange for it to go back into rhythm within half an hour of having this attack where he was grey and looked like he was going to pass out. So then they kept him in hospital overnight to observe. His bloods were elevated. They said something from the heart was leaking into the bloodstream, so they thought it could have been a silent heart attack. But the next morning, it was all cleared up, so they don't know. So I'm just praying and hoping that it doesn't get worse. So trying to relax and trying to put that out of my mind and trying to stay positive. And I'm like, Dad, can you just rest, please? Anyone who cares for elderly parents probably has the same feelings. It can be so frustrating, because one time my dad had a minor attack in the summer, went up to the hospital for a few hours, they sent him home. The next day he went out and mowed the lawn on a 45-degree day, had a massive attack, ended up in hospital having to get his heart restarted. And it's like, why would you do that? I don't know, trying to prove that you're still healthy or you're still young. I don't know, it's not worth it. But that's what my dad did. So I'm just hoping he'll rest up and he will be okay. But anyway, all I can do is just take care of me, because I might need, I could get called up any minute to support. But yeah, so anyway, that was a bit intense, but I'm home now. I'm having a cup of tea. And I'm getting back into my YouTube videos, my YouTube channel. And it feels good to have a place to vent, have a place to talk about my life and just get those feelings out, because it can be a lot caring for other people, and I haven't had to do that for a long time. I haven't had to go up to mum and dad's for a long time. They've both been a lot better and a lot healthier, um, which is a blessing, which is good. It's just a bit triggering when you think your dad's going to have a heart attack, it's a bit upsetting. But anyway, I'm home, and what am I up to this week? I'm getting back into my next module for my makeup course, my diploma in makeup. I'm up to my 4th module, and I've got to do a glam look, and my son has told me that I can use him as a model and do a glam look on him, so he's excited about that. He just loves dressing up and all that stuff, so I'm going to do that and do some cleaning tomorrow. I have a cleaning video coming up because tomorrow I'm going to be doing some cleaning. Ben's made the bed while I've been away. Yay, thanks Ben. Yeah, I don't know, it's just been a full-on few days, and I did post that video of me crying and it got like 800 views, and I'm like, oh my gosh, how embarrassing. I share a video of something positive and nobody cares, and I share a video of me crying and everyone wants to watch it. But some good news, I did get my birth summary, and I did get my letter saying that I have fibromyalgia. And I went to the doctors the other day with Ben and saw a new doctor because there was a doctor there. Hey, I'm just making a video. Ben's brought me chocolate. Oh dear. Oh, okay. Thanks, baby. So Ben's brought me some dark chocolate and some milk chocolate. I've been trying to eat just dark chocolate, but I'm feeling a bit stressed today. I'm going to have some real chocolate. So I've been pretty good. I've been pretty good with the chocolate. I haven't eaten a lot. And when I did want some chocolate, I ate dark chocolate. I've been counting my calories. I've lost about 2 kilos this week, so I'm getting back into it. But yeah, so I went to another doctor the other day. It was a doctor that I didn't know, never met before. He was a locum, and Ben came with me, and I told him about this pain that I'm having in my tailbone. And he sent me to a gynecologist, so he's given me a referral to a gynecologist. So I'm not going through the hospital this time. I'm going private. I'm going to go and see a private gynecologist. It is actually one of the ones that I met at the hospital. She has her own private practice when she's not at the hospital. So I'm going to see her because she was quite nice about this lower pelvic tailbone pain, whatever it is. I don't know if she can help me or whether I have to see somebody else, but I'm going to go see her first and see what she says. I have had a CAT scan on the lower half of my body, but nothing was really revealed. The doctor said to me, like, doing a scan may not show up nerve damage, like you may need an MRI rather than an ultrasound or whatever. And I tried to have an MRI a while back, about 6 months ago, I think, and I had a panic attack because I went to the hospital again. They told me under no circumstance was I to have Valium before I got there, and I said it's something that I take when I need it. I'm prescribed it. I know it won't affect me, and they said no, you have to have it when you get here in case it affects you. So I did the right thing because I thought if I get there and I'm groggy, they might be like, hey, you've had your Valium, we're not going to do the scan. So I was like, okay, I will do the right thing and take it when I get there. They gave me about 15 minutes for it to kick in, and then they took me through. It takes more than 15 minutes to kick in, so it hadn't even fully taken effect when they whipped me into the MRI machine. So, and then I had a panic attack because I was like, I wasn't allowed to move, and it's like, I'm a fidgeter, and I've got ADHD probably, like I can't sit still, I can't lay still. So, yeah, I don't know. If it turns out that I do need an MRI, I've done my research already, and there's a place in Sydney that offers open MRIs, so that won't be so claustrophobic. So I'm trying, I'm trying to get to the bottom of everything, but it's a long process, and I feel like I've made a lot of headway. Last year I had hyperplasia. I had that dealt with. I had a DNC, had a cancer scare. It turned out I just had wavy hyperplasia. There was no polyp after all of that. I've got gut issues. I've got H. pylori, which needs treating. and I went to see the gastroenterologist, and he put me down for a colonoscopy and endoscope, and then it was a 3-month wait. And then he told me that, well, the hospital told me it's a 12-month wait actually, because they're so backlogged. So I've decided to go private for that. So I'm going to ring up the practice on Monday and book in for that in a couple of months. When I need a couple of months to get my head around it. I can't just book in like for next fortnight because I'm scared. So I just need a little bit of time to just, okay, I can do this, but booking in a couple of months is still going to be quicker than just waiting. Otherwise, I probably won't get it till next year. And I just need to know. I need to have peace of mind. They can take a biopsy of my gut tissue and try to work out what antibiotics I can take to get rid of the H. pylori, because I haven't been able to get rid of it in the past. So there's that. And he was also going to do a FibroScan, which is a scan on my liver to make sure I don't have any liver damage, because something that I've been suffering from on and off over the last decade is an enlarged spleen and fatty liver, and it goes away and it comes back, and it goes away and it comes back. It's ever since I had my gallbladder out, ever since I've had my gallbladder issues, I've never been 100%. And it's really frustrating because my gallbladder stuff started when I was about 25, I think it was, when I had my second child, and things have just never been right since, So trying really hard to get to the bottom of that. I'm trying to eat better. I'm trying to eat more veggies. It's a very frustrating, long, drawn-out process, but I'm getting there. So again, I rang up and said, how long is the FibroScan going to take? Because I've already been waiting since March, and they said, we can't tell you. And I said, well, what if I go private? So I've booked in to get the FibroScan, and I'm going to get that done next week. So I am getting there. That'll tell me what's happening with my liver. So get booked in for my FibroScan next week, get my liver sorted, book in for my colonoscopy this year, get that, an endoscope, and get that sorted. And then going to see the gynecologist about my tailbone pain to see if they can help me, or at least point me in the right direction, because it feels like nerve damage in that area. And I never had that until I had my daughter. So I feel like after having 1 3rd-degree tear and 2 2nd-degree tears, there's some nerve damage there. So I always thought I had a 4th-degree tear. I don't know where I got that from. I'm sure someone told me that when I was in hospital. I was having a baby, I was on gas, I was a bit out of it. Maybe I got confused, or maybe someone told me that and they made a mistake and told the wrong patient. I don't know. Maybe, I don't know where that came from, but maybe just because of all the pain that I've had, I started thinking perhaps I had 4th-degree tears. I don't know. I knew I had a tear, but I'd never actually read my birth summary, so I didn't really know. Anyway, so now I know. I got my birth summary, I got 2nd-degree tears, but I've had 1 3rd-degree and 2 2nd-degree tears. So that, the doctor who I saw the other day said could just be nerve damage. So it might just be something that I have to live with. Apparently NDEP helps nerve pain, so I'm already on the right medication. So that's where I'm at. And someone said on my previous video, maybe you don't need a baby if you need IVF, and maybe if your health's so bad, you don't need another baby, and maybe you should listen to the doctor. And it's like, one, the IVF appointment is a preconception appointment to see and to make sure that Ben is healthy and to make sure that I am healthy. It's not that I need IVF. I don't think that I do need IVF. As far as I know, I'm not going through menopause because I've been tested and I should still be fertile, but I just want to make sure I'm doing everything right before we even think about that, And I rang them and they said, yes, we can do preconception appointments. I'm like, cool, awesome. So I am speaking to the right people. And then as far as my health is concerned, I've got gut issues and I've got back issues and I suffer from inflammation. My inflammation is mostly under control because of the NDEP. My back issues, I'm still seeking issues for, and I'm proactively trying to lose weight and exercise to strengthen my back and my core muscles. So I anticipate that should go away. My gut issues, I'm anticipating once I get my endoscope and my biopsy, that should go away. And the colonoscopy, I don't know. I could have Crohn's disease. I could have anything. I don't know. I've never been given a colonoscopy, but I'm hoping that I don't know. Like I said, I'm hoping it's nothing serious, but it's not going to be anything to stop me having a baby. You know what I mean? So yes, my health hasn't been great, but I'm proactively working on it. And if I can get it all under control and be healthy, then yeah, I'm going to look at having another baby. But as for the doctor, he was rude. I didn't do anything to him. I just simply said, could you write this email for me to get the birth summary? And he just started attacking me and telling me, I'm not doing that. I don't want to do that. Why should I? That's not what you expect to hear from a doctor. He could have at least phrased it differently and said, hey, I'm not your regular doctor. I don't feel comfortable doing that. Is this an urgent matter? Or could you see your regular doctor next month for that? Whereas I would have said, yeah, actually it is urgent because I'm nearly passing out from tailbone pain and I need a copy of this to take with me to sort of work out what's causing it, whether there's damage there that could be causing this pain, this nerve pain in that region. But he just started going off at me saying, I'm not doing it, I don't want to do it. Why should I ring the hospital and, call the police if they won't give me the information? I'm like, okay, you're not having a good day, but don't take it out on me, So anyway, that's where I'm at with my health, and I feel like I'm making gains. I feel like I'm getting there. I feel like it's a long journey and it's frustrating, but at least I'm getting somewhere, and at least I'm making gains. And I've lost a little bit of weight this week. I've been counting calories and it's hard work. It's really hard counting calories. I've got to eat like I've been eating between 1,200 and 1,500 calories each day to lose weight. And you've got to be really strict. You can't just go and have an extra bicky or whatever because it does add up. But like I said, I was counting my calories earlier in the year and I was eating about 800 calories, 700 calories a day, and the weight was barely even budging, So I really, really, really want to give this a hard crack at trying to get this weight off, because if I'm pretty much like I ate 1,200 calories the other day and I was so hungry and I was starving and I went to bed hungry, and I'm like, well, you know what? I've been tested for PCOS, I've been tested for insulin resistance, and they reckon I don't have it. So in theory, the weight should just come off, right, if I'm eating less calories. So I really, really, really want to give this a try, even if I have to go to bed hungry for a month. And if the weight doesn't hardly come off, then I can go to the doctor and say, hey, I'm eating this many calories a day and the weight's still not coming off. You need to do further testing. And I feel like it's the only way I can work out whether there is something going on, because I've been tested for so much and nothing much has come back apart from the previous issues I've already mentioned. So in theory, I should be able to lose weight, So I don't know. I'm just trying to do what the doctors have told me to do. The doctors told me to lose weight. I'm trying to do it. I don't want to have weight loss injections. I've tried Duromine, it doesn't agree with me. So really all I've got left is to eat less calories and exercise and see how I go. It's really, really hard trying to exercise regularly sometimes because of my chronic pain, but I'm trying to get that under control. And I did actually have a tiny drop of medicinal cannabis the other day, and it tasted so gross. I had like the tiniest little drop. I stuck it on my finger and just like licked it, and I was like, oh, it tastes so disgusting. And I felt off all day in the gut. Like, I don't know whether it was that or whether it was just a coincidence or whatever, but I'm going to give it another try next week, give it a real good, decent go and see how I go. Because everything I've been reading about it just sounds like every symptom I've got, it sounds like it would be helpful for. So if I can take it and I can tolerate it, it would be amazing, I think, because it just, like everything, like nausea, inflammation, pain, anxiety, everything, And I'm not going to say depression because I don't have depression. It gets so angry. Like, the whole point of my previous video was to say that, part of the point was that doctors are lazy. If you go in with a problem, they will turn around and say you have depression. And it pisses me off because it's not right. Like, I went in with abdominal pain last year and got labelled with depression. I had hyperplasia and needed surgery, needed D&C, and had a cancer scare because they thought I had a polyp, and they told me I had depression. And then my back pain over the years, like, oh, you've got depression. I have scoliosis and 2-chip vertebrae and chronic inflammation and fibromyalgia. So this abdominal pain that I'm getting, who knows, I could have Crohn's disease or something, I don't know. But every time I've gone in for real pain and been told I've got depression, there's normally like a core reason why I'm in pain, So, like I said, if I had depression, I would just friggin' say I'm depressed. I'd go and say, hey, I'm not feeling good. I'm feeling low. I'm feeling depressed. Not I'm in pain. I understand that the body can have pain. Like you can manifest physical symptoms to emotional stuff. I totally believe that. I'm not against that. But if a woman comes in with pain, I think the first point of call would be to say, hey, where is the pain? How long have you had the pain? Have you noticed any correlating things with the pain? Like, is it after you eat? Is it after you exercise? Like, let's investigate first. And if nothing comes back, we can try some antidepressants. Not first point of call is antidepressants and we're not going to investigate. That's just medical negligence. That's medical gaslighting. So anyway, like I said, just advocate for yourself. If you don't feel good and you go to the doctors and they dismiss you, say, okay, thanks for nothing. Walk out, just go rebook in with the next doctor. That's what I do. I walk out and I go to the reception and I say, that doctor did not listen to me. I have an ongoing issue. Can you please book me in with another doctor? And that is how I've had to deal with my issues. And then I found a nice female doctor, and she was like, she's the one who got me the referral to the rheumatologist, So yeah, anyway, I'm still on a journey with my back issues. I feel like there's something more than fibromyalgia going on with my back. I was watching this stuff on ankylospondylitis or something, I don't know, however you say that. And that sounds like a lot of what I've got going on with my back. But like I said, I don't know. I freaked out in the MRI. Probably the only way I'm really going to get a diagnosis for my back is to get an MRI. So I'm probably going to have to go to Sydney at some point and have an open MRI. But, that I've had back problems for 20 years. It can wait till next year. I'm going to get my colonoscopy and endoscope first, because that's more important, because I've been getting severe cramping, abdominal cramping, and bowel pain on and off for the last 12 months. So I'm going to go and get that done. As terrified as I am of that, I'm going to go and face it. I'm going to be tough. I made a promise to myself to do whatever it takes to get healthy, and I'm going to honor that. So anyway, that's my health update. That's my ramblings for today. And thank you for watching, and I'll see you in the next video.